the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thanks, Dave.
You're welcome.
Was there any public comment? Canara, did you have something?
Not really. I will,
Okay.
Probably in the coming days you will be hearing much about. We will need to allocate a new CDBG public services funding in the amount of $10,000. I'll be providing more information about it. It will be for general purposes. And there's also another news about Home American Rescue Plan. St. Charles County will be getting more money for homeless and people who are at risk of homeless. So, but these are announced newly, so there's not much to share right now. But we will be providing more information in the coming meetings, I believe.
Okay. All right, thank you for that update. I guess if I could get a motion to approve the September minutes.
So moved.
A second.
I'll second.
A second.
All in favor?
Aye.
Aye.
All right. Then we did have a budget revision request that I think we sent out in the email. Let me just pull it up here. I believe it was just to allocate, was it, Panera, was it 8,000 between two of the categories?
Yes, 8,000 from rent to utilities for St. Joy Cooking Care Service.
Okay. Can I get a motion to approve the reallocation from rent to utilities?
I'll make a motion. Cindy?
A second. All in favor?
Aye.
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 All right. All right. I guess if nobody has anything else, I guess we can go ahead and move into the presentations. Pinar, did you have anything you wanted to mention before we move into that?
Not really. I mean, we can continue, I guess, unless you have a specific question that you want me to answer.
Nope. All right. It looks like Youth in Need is getting us started tonight. So you can go ahead and start whenever you're ready.
Okay. I'm Dawn Tegler, the Regional Director of Runaway Homeless Youth Programs for Youth in Need. I feel like we do these every year and I try to change it up how I'm going to do it. And so I thought, everybody reads the application, so you guys kind of know what we do, but just a really brief overview. So at the shelter, we house kids 10 to 19. Generally, our census is 12 kids. With COVID, we've narrowed that down a little bit to allow for social distancing and spacing at the shelter. So we're kind of maxed out at 8. So census has obviously been lower, which has been a challenge. We take kids from all different kinds of circumstances, whether they've come into foster care for the first time, maybe been removed from a foster home. We have families that are in crisis, which COVID has really spiked that a lot. And so really just providing a much needed break. We're trying to prevent kids from running away, as well as parents from abusing their kids. And then the older group of kids, more the 17 to 19, are homeless youth that really have lost the support of family and stability. And so they're just kind of out there on their own. And so trying to kind of navigate those situations with them. So when you've come to the shelter, they'd stay for a max of 30 days. Obviously, when we encounter families, we try to make it less, more like 7 to 10 days. we don't want everybody to get too comfortable that they're like, we really like being away from each other, but rather, what things can we put in place and kind of get them connected again as quick as possible. So all the youth that come into the shelter, though, are assigned to a case manager that works on any case management they need, whether it's a driver's license, how to get a job, could be getting a birth certificate, or working on housing. So what's our next housing going to look like? Can we foster and facilitate a relationship with a long lost grandma or an aunt? Is there friends that they can live with? Are we looking at transitional living? Kind of what are next steps for them, as well as they're also assigned to a therapist. And so that person obviously works on any of the therapeutic goals and does family group and individual sessions with every youth. So I think everyone would probably talk about COVID. It's been a nightmare. I thought that 2020 was it and that hopefully we'd be turning a corner. I felt like we turned a corner for like 3 or 4 weeks. And then we went right back. So we've just had to do so many things so differently. Living in the virtual world has been a challenge. Even just getting staff trained and all the things that we needed to do has just been so different. We've had 3 COVID cases at the shelter, which if you don't know what a COVID case looks like in a communal living, it's really, really tough. We've literally had to isolate an entire house, and we have to halt intakes for 10 to 14 days, depending on the quarantine period. That's happened to us 3 times. One time we were stuck with 1 youth in a house for 14 days, paying staff to not only man the shelter, but also overtime for when we had slots that were open. And we weren't able to bring any other youth in. So it obviously has been a huge, huge budget drain on us. It's been really challenging. We do have a lot of things in place as far as when youth come in, they are quarantined until they COVID test. We have a partnership with IFM that's been doing all of our COVID testing. That's gone really well. We have a professional cleaning service that's now cleaning the shelter twice a week, just to really ensure that that's being done, as well as staff are doing, extra cleanings and all that. And then we also, it's a requirement at Youth in Need that you're vaccinated. So that's been helpful, I think, for staff. With them being out or quarantining, that has definitely lessened as time's gone on. So it's been rough, but we've made it and we've been able to survive to this point, thankfully. So I really wanted to kind of talk about a couple stories, just 2 stories of like how youth come to us and what kind of happens to them. So I oversee the shelter and the transitional living program and a small housing program for more transition age youth of 18 to 25. So a lot of times our services, they just go from one program to the next, which is really helpful. So we got this girl, I'll call her Jennifer. Her mom died in November of 2020 from a battle with cancer. She's only 18 years old. She's still in high school. She actually got her mom's car, is the only thing that she has left from her mom. She has no family at all. It was literally her and her mom. So she ended up at our shelter. We were trying to figure out where do we go with her. We happened to have an opening at our transitional living program. And so she went from our shelter to our transitional living program, and she lived there for quite a few months. And was able to transition out into college. So she finished high school, she graduated, and she's moved on to college, which has been amazing. We don't always get to see success stories like that. She has a lot of mental health. She's definitely dealt with, obviously, a lot of grief and loss, and things have been really challenging for her. We continue to do therapy services. She just came home last weekend. She had a break from school for the weekend and she just wanted to come home. And so I'm just really honored that she still feels like we're her home. We actually have a young professionals group that's really taken her in, and they've been sending her care packages. And it was nice for her to come home, and we sent her back with, a big care package to take back home. And so she's really excited to come for Christmas and Thanksgiving. And so, we always say once a yin kid, always a yin kid. But I just think that really shows like how fluid things are and how we do always stay really connected with our youth. So the second story is I just really want to talk about how critical our services can be. So I'll call him Mike. We've been dealing with Mike for 4 months now. June, August, September, and now October. So Mike first came to us. He was adopted at a really young age. His parents, very loving, caring, they absolutely adore him. And he has some mental health issues and he has some drug problems, mostly marijuana. And so they have been really struggling. He came the first time, stayed for 24 days. The therapist did a lot of work with him and his family. He went home, and as soon as he went home, they started fighting and he ran. And so he was on the run for like a week or two, and then he called and said, "Can I come to the shelter?" So he came to the shelter. We contacted his parents. They signed him in. He stayed again for 15 days. We did a lot of interventions, tried to do a lot of work with him and his family, get home. Of course, things don't go well again, and he runs. So he came, he was actually picked up by the police on Thursday, and the police said, he said, "Can I come there?" He came to the shelter. We tried to get a hold of his mom, and she's actually in the hospital because she's had a stroke. Dad's at home. He's had a stroke himself. He's not able to drive. So I said, we'll just get verbal consent for him to stay. And he said, "I just wanted to be at Youth in Need. Like, I've been sleeping in vacant buildings. I don't know what to do. I didn't feel like I could go home." So he was at the shelter for Thursday and Friday, and Saturday, he overdosed on fentanyl at our shelter. So I tell you this because he's alive and he's well. I feel like our staff were in such a dangerous situation. Our supervision is on point. We always say it's like a 3 to 5 minute rule. He was taking a nap. They heard some irregular breathing. Immediately, we're trying to determine, what's going on. They called 911. Our staff actively did CPR. They came, hit him with Narcan a couple times, transported him to the hospital, and he is okay. He's since been transferred to Cardinal Glen, and then they're going to put him in some substance abuse treatment and things like that. But I went Saturday to the shelter, and I told the staff, like, you saved his life. I mean, I think that he felt comfortable enough to be with us. Obviously, he has problems, right? But he's come to us 4 different times, and he felt some sense of safety and security there. And I'm so grateful that we do all the training that we do. We do CPR and first aid, and we make sure that all of our staff know about supervision, because the boundaries and the mental health issues that our kids have is a lot, and can be really dangerous and really scary. And we've never, I think in the history of Youth in Need, ever even had a staff do CPR on someone before. So it was really scary. And I think it's what we do. I think that we provide a safe place for kids, and I think that they feel really comfortable, and I'm just glad. I feel like the stars aligned for him. He was in the right place. He could have been in a vacant building and he wouldn't be with us today. And so I just pray and hope that he gets the treatment that he needs, and we may see him again. We just have to kind of wait and see. I just hope that he gets the help he needs. But anyway, so those are my 2 stories. And I think that that's really about all I have. I feel like if you guys have questions, I'd be happy to answer them. I know that you read the application, so you know a lot about what we do, but I'd be happy to answer any questions that you might have.
All right, thanks, Dawn.
Thanks.
Katie?
Uh-huh.
Dawn, in your years of experience, have you had other cases with overdose or suicide?
So in all the time I have been at Youth in Need, and I've been at Youth in Need since 2009, we have never had an overdose. And we've never had, we've had kids that are suicidal. We've done assessments. There's lots of therapists around. So I've done lots of assessments in my time, and we've taken youth to the hospital, but we've never had an actual attempt. So, I mean, I think that's one of the great things. We're usually able to intervene way ahead of time. We even do search kids when they come in. Obviously, we don't want, drugs or any kind of paraphernalia, but pills are easy to hide. So, I mean, that's easy to miss.
Yeah, thank you. Yeah.
I appreciate you sharing that story. because it just emulates that change doesn't happen in a linear fashion, and it's not always rosy, and giving us a peek into the hard work that you and your staff do. So thank you for sharing that. I had a question on your application. Your first outcome, you say it is that 90% participants who receive services at emergency shelter will secure safe, stable, and appropriate housing. Can you talk about past outcomes? Is that where you hover? I didn't see that previously in the application. I saw reference to outcome number 2, but so I was curious, what does that look like overall for kiddos who leave your shelter, their ability to maintain some stable housing?
So we do use that as an outcome quite a bit. And we also track beyond that. So when I say safe and stable housing, I mean a youth went back home, they went to a friend's, somewhere that we would consider safe. But we also do follow up. So we follow up with all youth after 1 month and 3 months to ensure that stability is still there. And that also provides us an opportunity to intervene if like more resources are needed, if additional services are needed, and kind of navigate from there. So we do also check up at the 1 and 3 months to just verify that.
And what have been your previous outcomes? Your target is 90%. What's been your actual?
I mean, I would say we are usually above 90%.
Okay.
Yeah. I mean, I don't remember a time that there's usually too far below. And if there is, there's usually a problem. So that's why we're trying to like always make sure that we're monitoring our outcomes so that if, that's not happening, like, are we doing enough case management? Where do we need, where might be the holes? But most part, we're always above the 90.
Which in and of itself seems like that's a very strong outcome for the population that you're serving.
Yeah. But, we always tell you, like, it's a voluntary program. We want you to want to be there. We want you to want to work the program, and we will do whatever. So if a youth is there for 2 days and they're like, this isn't for me, like, I don't want to be here. We'd rather drive you somewhere safely. Like, don't run. Like, we don't know where you're going at that point, and we always want to make sure that our kids are safe. So, yeah, we'll do whatever we can to make sure that they leave for some place that's safe.
All right. Thanks, Melinda. Did anybody else have any other questions for Dawn? All right.
Thank you.
Let's see. Thank you very much. All right. Our Ladies In is up next. You can go ahead whenever you're ready. Is anyone here from Our Ladies In?
That's a new one.
It would probably be Denise. I don't see her.
Do you want to just go ahead and skip to Turning Point? We can come back and check on her after that one.
I'm all for it.
All right, Turning Point. You want to go ahead whenever you're ready? I think you're on mute. I'm still not hearing you. Can anyone else hear?
No.
If you click on the 3 dots on the top of the screen and go to device settings, I think the audio options are in there. You might have to mess with the speakers in there.
Is that better?
Yes. Yep.
Okay, good. Thank you.
No problem.
I'm used to Zoom not so much teams. So,
All
okay,
right, go ahead whenever you're ready.
thanks. I'm Jen Weber, and I serve as the Advocacy Services and Continuing Quality Improvement Director here at Turning Point. And so I'll fill you in about the services that we have to offer. We do have a hotline. All of our services begin with our hotline, and that's answered by a staff member who's had domestic and sexual violence crisis training. During that hotline, staff provide crisis intervention. They listen to and validate the caller's experience, and they assist in safety planning. The staff make the caller aware of the services that the agency provides, both residentially and non-residentially, along with other community resources. The agency offers shelter to those fleeing situations of domestic violence, sexual violence, human trafficking, and stalking. The shelter houses female identifying victims and their children. Men are offered comparable services in hotels rather than shelter. Currently, our shelter is undergoing an expansion, which should be completed soon, and that's going to increase our bed space to 36. Right now, we're housing the ladies in our office building, which happens to be an old house, so our numbers are down to 10, which has also been particularly helpful with COVID. We do offer peer-led support groups. Those are offered daily to shelter residents, and they address a variety of topics such as healthy relationships, positive parenting, employment, economic empowerment. We have advocates that are available to assist residential and community clients with developing safety and survival strategies in the aftermath of domestic and sexual violence. Our life advocates, our life advocacy program stands for Living Independently, Financially Empowered. And this advocate meets with shelter clients on a weekly basis, and their
Hello,
meetings.
can you hear me? Hello, Denise?
Oh, all right. We could hear somebody, but Jen from Turning Point is giving her presentation now, so we'll come back. We'll come back to Denise. Sorry about that. Go ahead.
You're fine. So the life advocates meet with our clients on a weekly basis, and their meetings are focused on client-directed goals and that will assist the client in obtaining their independence after shelter. These goals typically are giving resources to clients, applying for public assistance, assisting in job searches, developing a budget and a savings plan. And we do also offer that service to community clients also. We have a court advocacy program, which provides accompaniment for victims to court, information, guidance, and emotional support. Court advocacy is available to both shelter and community clients, and they generally assist with orders of protection, victim impact statements, crime victim compensation, prosecution interviews, law enforcement advocacy, legal services referrals, divorce, child custody, and paternity. We have a substance abuse recovery program, and that advocate works closely with clients struggling with addiction issues by offering support, resources, and assistance. They do provide guidance to the clients in both individual and group settings. The substance abuse recovery advocate utilizes the SMART recovery program, and that focuses on building and maintaining a motivation to change, coping with urges to use, managing thoughts, feelings, and behaviors in an effective way, and living a balanced, positive, healthy lifestyle. We have had a few recent additions to programming. One of those is the Child Care Advocacy Program, and that enables single mothers to be able to work and save money while staying in shelter so that they can gain their independence and achieve permanency outside of shelter. We've also recently added the Rapid Rehousing Program. This program assists those fleeing from domestic and sexual violence receive and maintain housing while clients work on self-sustainability with an advocate. We have a counseling program which provides therapeutic services to assist both the residents and community clients with developing safety and survival strategies. The counselor works with individuals to support with the improvement of mental health and well-being. The therapeutic goals include, but aren't limited to, increasing awareness of the cycle of abuse, aspects of healthy and unhealthy relationships, expression of emotion and processing of past trauma, boundary setting, assertive communication, problem-solving skills, increasing their self-confidence, coping skills to support emotional regulation, and increasing natural support systems. So this past year, the agency served 253 women, 12 men, and 50 children. We sheltered 100 women and 30 children, creating a total of 4,205 bed nights. The agency responded to 735 hotline calls. There were 132 life advocacy clients, 192 court advocacy clients, 25 substance abuse recovery clients, and 59 counseling. The agency served 42 domestic violence survivors. 8 of those survivors are 8 survivors of sexual violence and 9 of human trafficking that were all from St. Charles County. Did anybody have any questions? I know I kind of threw a lot at you.
I did have one. You just mentioned the number of calls in 2020, and that it looks like based on the application that was a little bit of a decrease from 2019. That's just because everyone's home, so they're not able to call?
Exactly.
I guess.
Exactly.
Are you seeing that? Are you seeing that increase in 2021 again? Now that things are maybe a little bit more normal than they were in 2020, or?
It feels like it. I honestly don't know what the statistics are yet, because we generally start running it a little bit later, our reports, because our fiscal year starts in July. However, our book that we keep our hotlines in quickly has been filling up. And it seems like we're getting several calls a day, whether it be outreach services or if, people trying to come into shelter.
Okay. Oh, is there a hand? I can't tell whose hand that is.
Denise.
This is Denise Bondren with Our Ladies Inn, just not coming into the meeting.
Oh, okay, no problem. We'll come back to you next.
Okay, thank you.
Can you, Jen, can you talk a little bit about how long do you track or follow up with a client once they leave your services? And you talked a lot about numbers served, but what were some of your outcomes over the past year?
So, wow, all right, got something right here. We track a lot of different outcomes. Once somebody leaves shelter, unless they request that we continue any services with them, or they request to be contacted, we do not maintain that contact. A lot of that is because of safety reasons. There may be times where somebody goes back to their abuser, and we don't want to make contact with them and cause a riskier situation. They are in shelter, just to kind of give a picture of that, for 60 days. Then we provide an extension opportunity then. And if they are still wanting to work on more goals, and they're still needing to achieve stability, then they go through that extension process every 30 days. So there's really no time limit to be in shelter. They just keep going through that extension process until they're ready, because everybody's ready at a different point. And so we don't expect everybody to be ready at the same time. So some of the outcomes that we track now, I know for CAB, are exiting towards more permanent and appropriate housing. And with our other programs, or other funders, we're tracking if clients feel less isolated during their hotline calls, if they're gaining knowledge about community resources, if they're gaining strategies for safety, if they're learning about safe and healthy relationships, if they are gaining critical thinking and decision-making skills, gaining knowledge about legal rights and obligations, avoiding and reducing substance use, and developing coping, stress management, and resiliency skills, and developing a positive self-concept and self-esteem, and having fewer emotional behavioral symptoms. And that looks like the main goals, the main outcomes that we're tracking.
All right, thanks, Jen. Did anybody have anything else for Jen before we move back to Denise? All right, thank you.
Thank you.
Denise, you're up.
Okay, thank you. I apologize. I was unaware that it was a team meeting. I'm actually in front of 201 North 2nd Street in my car. So anyway, I'm Denise Fondren. I'm the program director with Our Ladies In. We began Our Ladies In 1982. We have 2 locations, one in South St. Louis, and we began the one in St. Charles County in 2006. Our Ladies In is a shelter for homeless pregnant women and their dependent children. They can live at our shelter for up to 1 year. And what we do with the population we serve is the ladies come in, they are connected with a case manager, and with that case manager, they have several intakes. There's an assessment and an intake with the case manager, then with our registered nurse, our counselor, and the child advocate. And the client, together with those 4 program staff, they put together a plan that will help the lady move forward and take care of some things that have currently put her in the position of homelessness. And a lot of the population we serve, they either have trauma that occurred from as early as childhood. They also have mental health and substance use. So what we do is we work with our ladies to get them into a place of stabilization. And we do that with, once they set their goals, then we work with them on a continual basis. And they meet with their case manager to track the goals that they are achieving. We not only serve the moms, but we serve our children, because just as the mom had gone through a hard time, the children have also missed out on things such as health care and getting them into school, getting them connected to resources that will help them move ahead into the community once the mom is back on her feet. During the pandemic, we began with a full house with 12 clients, and as the pandemic progressed, we lost clients. A couple of them couldn't handle being sheltered in place, and then we did have some moms that were successfully housed into permanent housing. We have assessments done on our ladies, which gives us a determining factor of where we need to work with them. And while we understand that housing is important, it is important that the foundation be worked on so that once they do leave Our Ladies In, then they are able to be more successful in the community with stabilized housing, having employment and transportation, making sure that their children are receiving the necessary services, because while they're at Our Ladies In, we use the services in the community such as Preferred Family Health, Compass Health, Nurses for Newborns, Parents as Teachers, and those are just a few that we connect our moms to. And what happens when they leave, then those referrals are printed out for them, and they're able to have access to them to keep that wraparound service and to also help them maintain the position that they're in now that they have left Our Ladies In. We do have an aftercare program for 2 years, and this is optional, just as coming to our home is optional. The aftercare program continues the case management that began while they were in-house, and it goes for 2 years. And what the case manager does, she helps them to make it to doctor's appointments if they don't have their own transportation. If there's a mom that has court legal activity, she makes sure that they are able to connect with that and to stay on track of the things that's going to keep her stable. In 2020, I know we had about 124 calls that came in for our housing. We were able to house 31 of those ladies into our shelter. We had set some goals for ourselves for our birthing outcome, because a lot of our ladies that come to us, they have been under chronic homelessness. They have not attended any prenatal care. They have had no mental health. So our expectation was that a birth rate would be about 5 pounds, and then their gestational period would be something like 35 weeks. Our Ladies In, 37 weeks. Our Ladies In has succeeded that in the years that we have been in service, and our increase in gestational was about 39 weeks, and our weight for our babies born was 6 pounds to 7 pounds. So with them coming into treatment and, going to treatment and staying on top of their prenatal, then their pregnancies were able to be monitored and they had successful births. I'm trying to think if there's something else. Do you have any questions that would probably help?
Katie?
Yep, go ahead, Dave.
Yeah. Denise, that was probably one of the best presentations I've ever heard from inside a car.
Oh, thank you. Thank you so much.
That's okay. I'm curious, when the ladies come in, do you get them, or are they able to get vaccinated before or after their pregnancy?
Well, I'm sorry.
Go ahead. No, go ahead. Vaccination.
Okay, so the vaccination is totally, we have our moms talk with their doctors and let that be the determining factor. But we do have ladies that came into our shelter that have been vaccinated, and we do have ladies that have been vaccinated since they've been there.
Okay. I was just wondering how you treat that, and I imagine some women who come in are not vaccinated, and they probably should be. So I was just curious.
And yeah, and we, like I said, we leave that as a medical opinion between the client and the and her OD. Yes. But we do have a quarantine system when they do come in unvaccinated, that they have to be quarantined, for a period of time, and we monitor their symptoms, and they can be COVID tested after so many days just to make sure that they're not infected. And we do have, we have to wear masks throughout the day unless we're in our personal offices, but anywhere in the community area, everyone is required to wear a mask.
Okay. Thank you.
Thank you. Any other questions?
Did anybody? Yep. All right. Thank you, Denise.
Okay, thank you, and I apologize for the mix-up.
No problem.
Okay.
All right. Let's see. Volunteers in Medicine is up next, and I don't know if everybody saw. I think the presentation was also emailed to us earlier, I believe. So, Volunteers in Medicine, you can go whenever you're ready.
Can everyone hear me?
Yep.
Okay, I think I'm gonna pull the thing up. There we go. Can everyone see it?
No. You need to click on share content.
Okay, I gotta figure out how to get back out of this.
It is next to leave. There's a button,
Just a minute.
right hand.
Where is the share content?
Upper right. Just left to the leave button. Red leave button.
Upper right.
There is a leave button, red leave button, and share content.
Okay, hold on. You mean on the main page? I'm sorry, I don't work with this, so.
Let me. I don't have the presentation.
Let's see if this will work.
Oh.
Share.
Do you want me to share it?
Well, yeah, if you can. I'm sorry, I don't know how to do this.
Just this.
Can you see it and you can't see it now? Oh, here, wait a minute.
Okay, I will share mine then.
It's loading, so hold on one sec. Do I do a send? I don't know. You better share it. I apologize.
Just a second. I will. It is. Just a second, I'm trying to find it. Just loading. Yes. Are you able to see?
Can people see it?
Yeah, we can see it.
Okay.
I can't see it, but I guess I can. Wait a minute.
So everybody's seeing it, right?
Yes.
Here we
Yes.
go. Okay, can you put it in a presentation format? Great. Okay, I'm Karen Ellman. I'm a volunteer at Volunteers in Medicine, okay, next slide. Okay, we've been serving the needs of the indigent in St. Charles and Lincoln County for 25 years. We had a 25th anniversary celebration this past summer, which was pretty cool. We actually have our clinical director is actually one of the founding members of the clinic, Anita Hockett. So we serve adult patients not eligible for any other medical insurance. Our patients have chronic illnesses, primarily diabetes, heart disease, COPD. We are not a walk-in clinic. They do need to have an appointment. just like they would be going to their primary care physicians. So we're open 2 days by appointment only, and we have a referral network of medical specialists as needed, local hospitals for testing blood sugar, for blood and diagnostics. We are an all volunteer staff. This past year, we've actually gotten 2 retired pharmacists that are now helping out in the med room. And we've already had over 7,200 volunteer hours through September of this year, which you'll see in a minute is obviously increased over this past year, so, in 2020 during the COVID. So next slide. I show this every year in terms of value of services, and you are going to see that our overall amount of services decreased this past year, which has to do with the amount of patients that we had and the interactions, that we had with them, which was limited, obviously, due to the COVID. Okay, we had 8,900 volunteer hours valued at $422,000, but that is a 19% decrease over the previous year. Once again, we continue to be open 2 days a week, but we did not need as many nurses or doctors because we were doing online appointments. The pharmacy or the med room was fully staffed because we were probably the busiest of anyone because patients continued to come in, would knock on the door to get their prescriptions refilled. So we had $1.599 million worth of services, which was a 31% decrease from the previous year, once again, due to, fewer services that we were providing. But our budget was $129,000, which was 15% less than the previous year. A lot of that has to do with the drug program that we implemented starting in 2019 to decrease our pharmaceutical cost. We did have 42,095 patient visits, which actually was up 20% from 2019. But the reason for that is even though we had fewer patient visits for medical problems, we did have more patient visits for pharmaceutical refills because patients were getting more and more of their pharmaceuticals through the clinic versus having to go to an outside pharmacy for those. The pharmaceuticals that we dispensed over $800,000. Once again, that was down 24%. But our outside pharmacy cost was $58,000, which was actually 31% less than the previous year. So, and once again, that had to do with the fact that we have a program where we can get unlimited meds for a certain amount of money every year. Our clinic samples and dispensary of hope, that was worth $85,000. And then pharmaceutical company patient assist was about $677,000. That was also down about 20%. However, in the past year, more and more of the pharmaceutical companies are now primarily sending their drugs directly to the patient's home versus those coming to them, and then we give them out to the patient. So once we get them on a program, we can track their initial prescription to those companies. But then when they get refills, if the refills go directly to the patient's home, we do not have visibility of that. So that number's obviously a little bit low. But with all that said, we were able to continue to provide a $20 to $1 investment in terms of the return for the investments that people are making in our services. So, okay, next. Okay, so what have we been doing this year? We've continued the Dispensary of Hope pharmaceutical program. Once again, clinic pays a yearly fee of $7,500 for unlimited commonly prescribed drugs that are ordered weekly. And we do order them weekly. We have limited space, so we're able to do pretty much on an as-needed basis. Patients have those prescriptions filled and picked up at the clinic, and which decreases the number of drugs filled and paid for at an outside pharmacy. We had an overall savings of $14,000 by the end of 2020, and I've got some charts on that in just a minute. I'll show you. Once again, you might say, well, what's the big deal with these pharmaceuticals? Pharmaceuticals have always been our biggest budget item. And for years, it's kind of like, well, you know, drugs, that's pretty much set. What are we going to do in terms of trying to decrease the cost of that? But at the same time, we realized if we wanted to become more efficient in terms of the dollars we were spending and spend less, because, you know, we have to start every year, we have to start over in terms of fundraising. It's like we need to find out a way to decrease our pharmaceutical costs, which we have been doing over the past 5 years. So, okay, because of COVID, obviously, we had telemedicine appointments continued from March 2020 through the spring of 2021 with limited in-person appointments. We did notice a drop in the number of patients from 2019 versus 2020. And so this summer, we actually made calls to every patient that we had not seen during 2020 to see how they were doing, to see if they needed to set up an appointment and try to get them reestablished. I think for the most part, people that had really serious chronic illnesses like your people with diabetics, your diabetics especially, they continue to be seen even using telemedicine. But at some of your patients that maybe would only be seen once or twice a year, they kind of dropped off in terms of visibility. So we're trying to reestablish with them. We continue providing medication refills at the clinic, as well as the outside pharmacies. We continue using SSM Pharmacy for outside scripts. That has worked really well. They've been a great partner of ours ever since the clinic opened. The average cost to the clinic that we get billed for every month is about $3,500 a month, and I have a chart on that I'll show you. One of the things that we started providing actually right before, about a month before COVID hit, we were able to get a full-time counselor who was there 2 days a week. And with COVID, obviously the telecounseling worked out really well for him. So we were able to, basically the year before we had no counselor available. So last year he was able to provide 281 counseling appointments, which obviously was very timely, especially with COVID. And then this year so far, he's had 392 appointments. I mean, his schedule is filled Monday and Wednesday. You know, he sees 8 patients each day. And some of those are now coming in, but he's still doing some appointments by phone. And then the last thing that I want to mention, which I think is really important, is that we will finally start tracking our outcome measures in 2022. We have been tracking outcome measures on our diabetics for 10 or 12 years. We've been doing that for forever. The problem is our charting system is not automated. And so it's very difficult. We basically have to manually get that information from the charts, but we're going to do it so that, you know, we can indeed prove that we're, you know, the kind of outcomes that we're looking at. So each patient has always had those individual outcomes. We just have not looked at that as an overall group of patients. So we are going to be starting with our diabetic patients, and we track 3 measures on each diabetic patient. We look at their A1C, which is like a 3-month view of how well their blood sugar is doing versus like an individual blood sugar, which only gives you a picture for that one day. So we want their A1Cs to be less than 7, or in some instances, the patients may have a little bit higher number established because they are very brittle diabetic. And if you try to get that number under 7, and sometimes it can make their overall illnesses worse. So, but each patient has a number established. Typically, it's 7. The other thing we'll look at is the cholesterol. All of our diabetics are automatically on a cholesterol medication, and we look at the LDL, which is the low density cholesterol, which is the bad cholesterol. And then we also look at blood pressure. So we'll be tracking all 3 of those. We're also going to be looking at the LDLs on our non-diabetic high cholesterol patients. So we're going to, once again, that's going to be our starting point in terms of looking at that overall versus just individually. Next chart, please. Okay, just want to share this with you. This was our medicine room utilization of our Dispensary of Hope medications. We report out on a monthly basis to the Dispensary of Hope organization what our utilization is. So we look at 30-day scripts. We typically will issue a 3-month script. So a 3-month script means it's 3 30-day scripts, just so you understand that. And as you can see, we were, moving right along. And then as COVID hit, we had a higher instance. If you look at, I've got this bar that's in my way here. But the numbers have been going down, and now it's beginning. It was ticking up, and then it was ticking down again. So we also look at the total patients and the unique patients. So total patients is the overall number of scripts that we issue on a monthly basis, and then unique patients is a patient may get 3 scripts, but they're only counted as 1 patient. So those numbers have been relatively stable. The next chart is our Dispensary of Hope medicine value versus the outside pharmacy medical cost. Once again, if you look at the blue bar for the outside pharmacy cost, if you go back to the average between January 19 and May of 19, our average was running about $7,500 a month. And because of this program that we got on, where we're issuing a lot of our own medications through the clinic, we are now down to, and it's been really quite stable since we've gotten on board with SSM, and it's about $3,500 a month. So yes, we've had, some decrease in the number of patients, but not that great, so that the number has, been relatively stable. The other thing, the DOH value, we do put a value on the drugs that we get from the Dispensary of Hope. And that's not the retail value that just any pharmacy would give it. For example, a cholesterol medication that we would get from the Dispensary of Hope, they would put like a $300 a month cost on it, which is crazy. What we do is we've developed a program where we identify what a cost would be through RX, Good RX at Walmart, which is probably where our patients, if they were not getting free prescriptions from us, that's where they would probably go fill it, and that's where it's cheapest. So that's how we get our overall value in terms of that. So you can see that, that value, is likewise, it's probably average, it's more like around $4,000 a month in terms of the drugs that we're giving out. So you can see if you add 35 and 4, you get your 75 that we started out with back in May of 19. Next chart. This just goes to show you our improvement initiatives to decrease our clinic paid medications. Back in 2015, we were spending $110,000 a year. And at that point, we started an initiative to give a $10 copay for controlled substances to get those numbers down. You can see the number went down in 2016. In 2017, we started our automated inventory system and started getting samples from AmeriCares, which was limited, but at least we were getting some samples. In 2019, we started the Dispensary of Hope medicine program. And as you can see, that number went down to like 59,000 at the end of 2020, and we expect it to be around 52, I think, by the end of this year. So we have met that. I don't really see that we're going to be able to that much lower. We've kind of maximized that out, but we certainly want to maintain those kinds of numbers. So next chart. Oh, that's it. So thank you for your ongoing support. We really appreciate it. It's been a tough year. We're all tired of wearing masks. The docs are tired of gowning for every patient, but we continue to do what needs to be done. So if you have any questions, I'll be happy to entertain those.
So Karen, this is Melinda. Oh,
Go ahead, Melinda.
I just want to say congratulations on identifying outcomes and starting to track them. I know that I've been asking you for a number of years about it, so thank you. And I just also wanted to recognize your creativity in decreasing your costs without sacrificing quality and services for your patients. It was very impressive to see how you, through your resourcefulness, have been able to drive down that pharmaceutical costs from year to year. So I just wanted to recognize that. That's pretty amazing.
I've been pushing for outcome measures, and like I said, they've been there, but it was a matter of trying to mine the data. So we finally I bit the bullet, and it's like, we're going to do it. So it's there. It's a matter of doing it manually. So
get some intern med students in and make them go through the data.
We'll get some help, obviously. So. Can you all see my pug? I don't think they can.
Katie?
Sorry, I couldn't get my mute to work there for a minute. Go ahead, Dave.
Yeah. Karen, I was just curious, does Volunteers in Medicine have a policy toward vaccination of your population group?
That's a good question. We are, as the patients come in, we're asking them if they've been vaccinated, and we're tracking that, and we make note in their chart. And ballpark figure of the patients that have been coming, it's only about 20%. We give them information in terms of where they can get it. People say, well, why don't you give it at the clinic? And it's like, it doesn't make sense to give it at the clinic to me, because it is available to patients so many different places. Right. And as someone who worked the many vaccine clinics at Family Arena, as you know, once you dilute some medication, it's only good for 6 hours, and you don't want to be wasting shots. So, it's frustrating, to say the least, that, they have not gotten the shots. But then again, maybe that's one of the reasons that they're coming to our clinic,
Right.
But it's very frustrating. I do want to mention that really appreciate St. Charles County, our nursing and medical staff. Back in the end of December, we were one of the first groups that were able to get the vaccinations through St. Charles County. Was great, but we really appreciate that. I mean, we're all, 90% of us are over 65. We really did need to have that, but that was great that we were able to get that early on, which obviously helped us. And then, we didn't even have to wear masks for a couple of months, but then when things started to, break out again, now we're back in our mask again. So, anyway.
Okay.
But yeah, I really appreciate us, being able to get that. So.
All right. Thank you, Karen.
Okay, thanks.
All right, up next is Connections to Success. Go ahead whenever you're ready.
Awesome. Thanks. Can everyone hear me okay?
Mhm.
All right, awesome. My name is Linda Keaton. I'm with Connections to Success. We are a 23-year-old nonprofit headquartered here in St. Charles. We do have 5 facilities throughout the region, St. Charles, St. Louis City, East St. Louis, Kansas City, Missouri, and then Kansas City, Kansas, with the past 2 years, we've also had a satellite office in Columbia. So we really are trying to kind of capture all those areas throughout Missouri. Again, the focus with the headquarters being here in St. Charles, we also then operate the Dress for Success affiliate at that location as well. So as a nonprofit here in St. Charles, we are working with kind of a holistic model. Our model is called Pathways to Success, and although we're not directly serving the homeless or homelessness population with housing or shelter services, our goal is really to impact each individual on their journey towards economic independence, which we all know then has a direct correlation to their safe and stable housing situation. So individuals are coming to us from all different walks of life, different circumstances. Some may be in safe housing, but it's not stable. Vice versa, it may be stable, but not safe. And then we're also working with a lot of individuals that may be living in transitional housing as they're re-entering into the community from one of the institutions here in Missouri. So we do have a strong emphasis on that employment aspect, as well as also then helping to address some of those re-entry obstacles that these individuals are facing. So knowing that each of these individuals kind of is a different point in their life, we really want to focus in on what's going to be most needed for those individuals. So obviously those immediate basic needs are assessed from our life coaches, but each individual is going to go through that signature program that we call personal and professional development. It focuses on all areas of their life. So employment, education, health, with a strong emphasis on that mental health, family situation, transportation, really trying to address where each individual is, in particular in those areas, and trying to get stability in all of them. And we're not experts necessarily in all those areas. We do rely heavily on our community partners and collaborations within all of the communities that we serve. Our strongest emphasis is really that employability, getting individuals to a point where not only to be able to secure employment, but actually find a job that pays a living wage. So we have an employment specialist that then also works side by side with each of these individuals to understand what their skills and talents are, what their interests are, but then to also connect them with employment that is going to not only just meet those basic needs, but really put them in a situation where they can be stable with housing and transportation and medical care for themselves and their families. So they go through a 3-week training that we are now back in person. Thank goodness we resumed in person in July. It's been a slow transition. We are taking it slow for many reasons, but it's been so nice to actually have real people back in the office and have that interaction with them on a daily basis. That piece of our program is actually crucial. A lot of individuals are coming to us with broken relationships, low self-esteem, just kind of that hopelessness, and having that personal connection with them really helps us build that rapport and that trust. It's a volunteer program, so they're not being forced to come to us. So the fact that they choose to come to us shows that they're in a position where they're willing to change and improve the situation that they're currently in. So they go through that 3-week training, during which we're identifying what are their immediate needs, what are their long-term goals. The life coaches are working with them one-on-one in addition to the training facilitator. And then after those 3 weeks, they move on to an individualized program plan. So that's really set up for them to determine what direction they're looking to take, and then what obstacles and barriers that they may have to get there. And that's where our life coaches really work intensely with them, tracking those progresses, those successes, whether it be securing employment, getting a pay increase, moving out into their own apartment, securing a car, whatever those little successes are on their journey to that economic independence. In addition to that, one of our strong focuses with the job developer, again, is to really find those companies in the community that are really paying those hourly rates that really do set someone up for success. We're not always going to be able to jump right into those higher paying jobs. And that's why we do have kind of that 1-year commitment with individuals on the forefront of them joining the program. But we do offer them that lifelong engagement. So for some, they may jump right in at a high paying job, may not need our assistance for that much longer afterwards. But for others, it may take a little longer. They may have more obstacles, especially when you start throwing in any kind of criminal backgrounds. So we're also working with companies that do that second chance hiring and a little bit more forgiving on individuals' bad decisions, bad choices back maybe when they were younger that are still kind of haunting them today. So that's those initial 3 weeks. Beyond that, really determining if they need to do any kind of education, get any kind of certificate trainings, what's going to set them best for securing employment. And then we connect them with other community partners to ensure that all of those areas are stable. Because we all know if one of those areas in life is off kilter or out of balance, it's really going to then impact. If someone doesn't have stable transportation, it's harder for them to get to work. If it's hard to get to work, then obviously you may be late or miss a day here and day there and get terminated for whatever reason. So it can be definitely a trickle effect if one part of your life isn't quite where it needs to be. So that's really kind of a quick snapshot on how individuals get involved and the kind of things that they do to kind of move forward. COVID obviously has impacted us just like everybody else. We've had to pivot. We've had to kind of change the way we deliver some of our programming and slowly, hopefully, start getting back to offering some of those additional workshops and ongoing support groups that we used to have prior to COVID. Understanding that having that social outlet that is a positive and supportive environment is crucial to those times when things may be going well, but then an obstacle comes in your way. How do you handle it? And so having some of those additional resources within the facility that we offer, whether it's ongoing career workshops, development workshops, tutoring for high set if you're still working on your education, so financial literacy, so on and so forth. So a lot of those things are now coming back into play with more and more places opening up. So with a focus, as I said, on that reentry population as well, we've been able to get back into the Missouri prisons to do some of our training. Prior to COVID, we had signed an agreement with the Missouri Department of Corrections to provide training to 5 institutions where we would go in and train their staff to then deliver our program internally prior to these individuals released into our community. So just trying to do some proactive programming to help eliminate some of the barriers and obstacles that these individuals are facing in the community that can then ultimately impact what their housing stability looks like. And in addition to that, we're back into the alternative high school where we were doing programming prior to the pandemic. We've been able to resume that this semester. So working with about 19 youth within the alternative high school in Wentzville, adapting the program a little bit to meet the needs of youth, understanding they have some different challenges to some of the adults that we're serving, but providing that training throughout the semester in small increments. So there's some of the things that we've got going on. Sounds like a lot, and I spoke really fast, so I apologize. As far as some outcomes, we all know data drives a lot of us, and so we do track some of those statistical outcomes in addition to some of the more subjective. So just really being able to evaluate an individual that feels more hopeful about their future, has better cognitive skills or better relationships with their family. But then as far as some of the other outcomes we're tracking, our goal is to always have individuals secure employment within 6 months of completing the program. We sit typically around the 74% mark. Our goal is always to at least get to 70 within the first 6 months. For those that are also then working with a conviction in their background, the goal is to obviously reduce recidivism and have them compliant with any parole obligations that they have. So on a national level, recidivism rate is 44, Missouri is 28%. Our goal is to keep that at 10%. So this past year, we have to kind of go back a whole year so that we can get an actual number. We're sitting right around the 8% mark. So we're definitely having an impact on recidivism, which obviously has a multitude of benefits in addition to individuals just being more economically stable. Currently, with those individuals that have been part of our program since March, our employment rate is sitting at 74%. The average starting wage is sitting around $14.51 per hour. And those that have been with us at March as of right now is a 0% recidivism, but that's really not a true value until they've been with us a little bit longer. So really just trying to keep doing what we're doing as far as what our 2022 outlook looks like. Again, just focusing on that starting wage and making sure it's in a job that people have the opportunity to grow and develop and earn whatever income they're going to need to support their families. So in a nutshell, any questions?
All right, thanks, Linda. Does anyone have any questions for Linda?
Great, thank you.
Great, all right. Sorry, I have a girl here who's learning about all these great organizations. All right, last but not least, let's see. We have Habitat for Humanity.
Yes. Can you hear me?
Yep.
Okay. I promise not to take too much of your time since thanks for sticking around. I am Laura Mueling. I am our Grant and Development Services Manager for Habitat St. Charles. I know a majority of you know about our mission work, know what we do in the community with our families. Some of you have even been on our job sites and have built on our homes before. But just to kind of give you a quick summary of what we do, we provide safe, decent, and affordable housing for families who are currently living in substandard housing throughout St. Charles County. We are actually getting ready to celebrate our 25th year. And in that time, we have partnered, at the end of this year, we'll have partnered with our 92nd family in homeownership. And our families all perform sweat equity hours towards the building of their homes. We do new home builds majority of the time, but we do purchase homes throughout the community as well and do rehab work with those homes too. Our families also go through financial education throughout their partnership time with us. Each session that they attend is a new topic on some sort of financial education, such as how to create a budget, giving them saving tips. We have taught Dave Ramsey's financial peace education to our families in the past as well. And we also prepare them for what to expect for homeownership. They go through a class on what those closing documents look like, what those closing documents mean, picking out their insurance for their homeownership and for homeownership, things that they never had to think of before, things that they've never gone through before. We hold their hand through that process so that by the time they complete their sweat equity hours, they do either 300 hours or 450 hours towards the building of their home. So once that is completed and once their home is completed, they do close on the home and they sign a mortgage on that home, and it is affordable mortgage for them. Affordable that for them means that they aren't paying more than 30% of their income for their mortgage payment. So just to kind of fill you in on what we've been up to this past year, despite 2020 and COVID, we actually kept pretty busy. We were able to select families and then break ground on 2 homes in North St. Charles City off of Transit Street. And then almost immediately after we broke ground on those homes, we had to shut down our site for several months with the pandemic. We canceled all volunteer opportunities. We didn't have any volunteer groups on our site for several months. We fortunately were able to still build on the homes. We had our construction staff, our one construction staff member and one regular volunteer that came out who were able to continue the process with our home build. Obviously, it was a much slower process than our typical 6-month process. We were able to finally finish these homes this past summer, and one family did dedicate on the home and close on the home just a couple months ago. Her name is Luwanda, and she moved into the home with her 2 granddaughters that live with her full time. She's been paying on her mortgage regularly. She's been thriving in homeownership. She's a golden example of why we do what we do. Before Habitat came into her life, Luwanda was living apartment to apartment. She had moved 5 times in 8 years. She had several safety issues with her granddaughters. They had lost several possessions, break-ins with their homes, health issues with their homes, mold and structure issues with their old apartments. So she's really seeing the importance of home right now with having a safe, stable, secure place to live for her and her girls. 25% of our homeowners saw a decrease during 2020 of their income due to the pandemic. So we were able to see firsthand the importance of what affordable homeownership is right now during this time, especially with the recent soar in home prices and home costs, because of our homeownership mortgage payments being able to remain affordable for them. And because of community assistance throughout this past year, all of our homeowners were able to remain in their home, were able to keep up with their mortgage payments, were able to catch up with their mortgage payments if they were behind, and able to stay in their home. So with the current request that we are currently asking for the Community Assistance Board, we are breaking ground on 3 homes in North St. Charles City. Off of North 8th Street, we were able to purchase a lot and subdivide it into 3 lots. We plan to break ground on 1 home. We just got permits this week actually for these homes. So we're planning to break ground on 1 of these homes before the end of this year. And the remaining 2 will go into our next building season. Our 1 family is already selected for our first home that we will break ground on. It is a blended family of 5 who are currently living in an overcrowded 3-bedroom apartment. So they are looking forward to starting their process, starting their sweat equity, and starting their journey into this home. With our other 2 homes, we will start our family selection process in January, like usual. We will go through our homeowner, the application process. They'll do an interview process with our family selection team. They'll go through background checks, we do credit checks, we do home visits of their current home, and we take our selections to our board of directors for approval, with the hope to break ground in April of next year so that we can get back on our normal track of our home builds being May through November so that our families can be in their homes by the end of the year. That is just kind of a summary of what we have going on, what we've been doing. I'm happy to answer any questions that there are.
Lauren, what does housing affordability look like in St. Charles County these days? Well, really the Tri-County area.
I don't know for sure. All I know is that through personal experience, home prices have been increasing quite rapidly. The cost of lumber, the cost to build new has also been increasing. So we have been outsourcing for donations. We've been going to get our roofs donated. We actually started a partnership with the prisons to get all of our cabinets donated for the homes as well so that we can keep our costs low, and try to keep as much affordability still as possible.
Lauren,
Yes.
you know, the last time the cab met in person physically was at a Habitat.
Yeah.
Do you remember that?
I do, yes. We hung out in the drywall.
That's did that family ever move in? Do you know?
They did, yes. We did a small dedication ceremony in August last year. Typically, we invite the public, we invite everybody to join us, but we kept it to just her family, and we showcased it on Facebook Live so that people could join in and watch. But yeah, they moved in last August.
I think if we ever go back to meeting physically, which I hope is like tomorrow, I think we should go back to that house, have it in a garage or something. I don't have a meeting.
We do have a home off of North Fifth Street right now that just got their trusses set. So we have a home that we can be inside of.
Okay. Well, I'm glad to hear they moved in and things are going good then. So
Thank you.
that was a
Yeah.
nice house.
Yeah, that was one of our rehabs. That's we basically gutted it from the ground up and rebuilt it from inside. Yeah.
A lot of work going on. Yeah.
Yes.
Thank you.
Thank you.
All right, any other questions for Lauren? All right, I think that was the last one for this week. So next meeting is Tuesday, November 9th. I guess Pinar will send out another invite for it.
Yes.
Anyone else have any last comments? Thank you guys, everybody, for the presentations and all your time on the applications. Everybody did a great job.
I move to adjourn.
All right. Do we need a second on that? I don't know.
Yeah, you do.
Second? All in favor?
Aye.
All right. Have a good night.
Thank
Good job.
you.
Katie.
All right.
Good night.
Thanks. Bye.